Welcome everyone to today's webinar, Doing More with Less, Navigating Healthcare Marketing in a Time of Constraints. I'm Farah Hunt Thompson, Vice President of Partner Relationships for Greystone.net. I'm going to go over some housekeeping items before we get started today. We'll be answering your questions at the end of the presentation, and to ask your question, please use the Q&A button or chat at the bottom of your navigation. Due to the size of attendance, attendees are in listen mode only to cut down on background noises. And there is a short survey at the conclusion of the webinar today that we would appreciate your feedback on. I'd like to introduce Dave Twitchell, Head of Marketing at FreshPaint, to introduce today's speakers and begin today's presentation.
All right, thank you, Farah, and thank you everyone for joining us today. Our discussion today on navigating healthcare marketing and communication in a time of constraints and how you can do more with less, I think is particularly timely. Over the last several months, we on the FreshPaint side have heard consistently from our customers and others in the industry we talked to about the budgetary pressures that they're under, sweeping changes to the healthcare landscape, both from new federal and state regulations to changes in Medicaid and Medicare from the Big Beautiful Bill mean that many healthcare organizations are unsure about the impact of their revenue streams. And this uncertainty is driving budget cuts for many marketing teams. So I am so excited for today's discussion. As Farah mentioned, my name is Dave Twitchell. I'm the head of marketing for FreshPaint. Before we dive into the conversation, I'm going to give you a very short overview of FreshPaint. We now work with over 250 healthcare organizations, everyone from hospitals and hospital systems to regional and national payers and other healthcare providers, helping the marketers within those organizations unlock full funnel marketing. We give our users control over their first-party data and enable them to share things like conversion data with ad and analytic tools while protecting patient privacy and keeping you on the right side of both federal and state regulations. Timely to this discussion, we recently announced a product called FreshPaint Audiences, which enables healthcare marketers to utilize audience targeting strategies like lookalikes, retargeting, and suppression lists that have long been out of the reach for many healthcare marketers because of privacy regulations. This helps make sure you are optimally targeting your audiences, making your budget stretch further. If this sounds like something you're interested in, you can scan the QR code to learn more, or we'll have this up again during the Q&A. All right, so enough on that. We want to dive into our discussion today, and I'd love to take a minute and introduce our speakers. So Alan Shoebridge is the AVP of Communications and National Chief Communication Officer at Providence. Hi, Alan. Thanks for joining us. You want to say hello to everyone?
Yeah, thanks. Looking forward to the conversation. So thanks for having me, Dave.
Yeah. And Suzanne Hendry is the Chief Marketing, Communication, and Customer Experience Officer at Renown Health. Hi, Suzanne. Thanks for joining.
Hi, Dave. Thanks so much for having us.
Yeah. All right. I'm going to stop sharing my screen here, and we'll just dive into the discussion topics. So the first one is around budgetary pressures and uncertainty. So, Alan and Suzanne, you're both seeing cycles of budget cuts, and we don't have to go too far back in our memory to remember things that impacted us, like the COVID time of 5 years ago. So how does today's uncertainty compare to past crises like COVID? And Alan, I'll start with you.
Yeah, well, it's a great question. And, I hope that nothing really ever compares to what we experienced in COVID, because the uncertainty there was just, I think, at a level that I'd never seen before. And thankfully, we haven't really seen since too much. But, like 2020, when that hit, really just called into question, like, what are our facilities going to be able to do? Are we even be able to see patients? Aside from like the units that were treating COVID, things were like locked down. Clinics weren't taking new patients. Things were transitioning to telehealth. So there was a lot of just, uncertainty about what happens to our industry, what happens to our communities, what happens to us as people. So I feel like that's an area that is pretty unprecedented. Hopefully, we won't see really ever again. But what's happening right now, it is a high level of uncertainty. I think from like a sort of budgetary perspective, especially with some of the potential impacts that are coming to Medicaid down the road, and some of the things that might happen next year with like enrollment in the ACA. Plans, things like that. There is a lot of uncertainty, and so that is putting pressure on healthcare systems that many have not fully recovered from the pandemic. Certain and at Providence, we've been struggling. I think we finally had some really good economic results in the last couple of quarters, but it's been tough. So, looking ahead to next year and then probably the next 2 or 3 years, we know we've got to get smarter about what we do. And I know that we're going to talk about that later today, but it's not going to be business as usual. But the nice thing is, I think compared to like when you brought up COVID, we know what's on the horizon for the most part. We know how to prepare, and we're going to be able to do that, I think, moving into next year. So the uncertainty level is high, but I think we're in a position to really get ahead of it to some degree and be proactive as much as we can, looking ahead to next year.
Yeah, Suzanne?
Agreed. I think we're stronger having gone through something like COVID with our teams and our organizations and our communities. Certainly, the trust factor for healthcare increased significantly, and we learned. I know, Dave, you're going to talk about doing more with less, but we learned how to do important things on a shoestring. And we learned how to be very creative and resourceful with our teams and pivot at a moment's notice. And for many people, they really learned what the value was of communications and digital and marketing and employee engagement during COVID. So I think we have a strong foundation on which to build from.
Yeah, so double clicking there and going back to our prep call, Suzanne, one of the things that you talked about was how going back to COVID, you were able to leverage your PR and your communication team like as a strength. Do you want to talk a little bit about what that experience was like and how it's helping you now?
Sure. One of the things that our team has really navigated successfully is the skill base that you have in marketing. Even if you have more patients than you can accommodate right now, the skills that our marketers have are really valuable. So one of the things we were able to do here at Renown Health in Reno, Nevada was repurpose our marketers to help with employee recruitment and physician recruitment and put their marketing skills to use, geo-targeting other areas across the country where people might be interested in coming to a place like Reno, Nevada. So we were able to take on additional programs and services for our organization and sunset outside consultants that we might not have needed at the time and really demonstrate and show our value. And we've continued to do that since COVID. And now we are the employee and physician recruitment experts working hand in hand with our HR team. So again, sometimes there's a silver lining in a crisis.
Yeah, absolutely. One of the things that we've touched on early a couple times is uncertainty. And obviously we as marketers all have a job to do for our organization, which is to help us grow, but we're also all leaders of people, and behind everyone on our teams is a family and all those other things that we do outside of work. So Suzanne, you talked a bit in our prep about not blindsiding staff during times of uncertainty. And so what does transparent leadership look like as you're going through tough times, and how do you help lead your team through that?
Thanks, Dave. And thank you for bringing up this, what I think is a really important issue when you're navigating difficult situations. And that is you're not in this alone. And it's really important to know that as a leader of your team, people are loyal to you, and anything that you can do to preserve their livelihood during times of reductions in force or uh, restrictions on resources is really important. So I'm hoping that we're getting beyond the surprise attack in healthcare where reductions in force are something that is kept quite secretive, and people don't know what's going on until the 11th hour. And then all of a sudden, your communications team are on high alert. um, I hope that people understand the financial pressures that their systems are under, and that we're talking to our teams about that, and that we're coming up with creative solutions, and we're taking every opportunity to reduce costs and unnecessary contracts or applications, um, and keeping really good account of that and working together as a team to be able to address this as a team and not in a vacuum, because no one likes a surprise, and this is the worst surprise of all. So I think authentic leadership means having these difficult conversations with your team and having everyone participate in resource and problem solving.
And you, if you wouldn't mind retelling it, and I think this was a story from previous, not necessarily pertaining to this exact time, but in another time, you mentioned that you had a conversation with the team and actually found out that someone was actually exploring some other career path, and that so like, talk about how do you have those kinds of conversations, and maybe what that example looked like.
Certainly. And we all know when resources get tight, you both have operating expense and salary expense. And if you are fortunate enough to be able to work with um, operating expenses and trim advertising and trim other things, that's wonderful. In some organizations, they come to you and say, you need to reduce your salary budget by 10%, 20%, 30%, or more. So I've been in organizations where we've had upfront conversations with the team to say, we need to reduce our salary expense by 25%. That's what this equates to. Is there anybody on the team who would like to work half-time or three-quarters time, or is exploring other opportunities? Or maybe you're pregnant and you're going on maternity leave and you haven't told anybody yet, and we can take that vacancy factor against our salary budget. So I've had supervisors who sat with us and did exercises like that, and we found out people wanted to get off the bus with their kids at 3 o'clock in the afternoon and wanted to go halftime, or were thinking about retirement. So we had those conversations as a team, which really brought us closer. And again, no one was blindsided at the last minute. And for me, I look back at that and I think how brave that manager was to have those conversations with us.
Yeah. Alan, over to you on, you have your team at Providence there. How are you keeping morale high and kind of being proactive and transparent in times like
Yeah.
that?
Yeah, well, I have really kind of had this guiding principle, and people who know me might have heard me say it, but there's this wonderful quote: "So the pessimist complains about the wind, the optimist expects it to change, and the realist adjusts the sails." And I've taken the approach that we've got to be realist about what's going on. We have to adjust our approach. So when I think we get into situations where we really want to look at the work we're doing, ask people like, where do you see opportunities to do things differently? What can we stop doing? And I know people often say like, "Hey, let's stop doing stuff," and they never do. But really, as a leader, you can empower your people to actually do that. Like, to dig in, like actually get some information from your team about, are the things that really like, hey, we're doing it, but we don't really know why. It's funny that people might think that that's a silly thing to say, but I guarantee almost on every big team, there's some project as a leader that, you asked for 5 years ago, but someone's still doing back in the background. And are we sure that that's the right work? Are we sure that people need it? And asking the team, is there a better way to do it? Maybe someone's spending, 20 hours a quarter on something that they could be doing in 5 hours, and that work could be shifted to something else. Maybe there's an expense or a vendor, again, that's like, maybe we're not getting the right performance out of them. So I think it's really just adjusting to the reality. Like, the wind is blowing a certain way, we can complain about it, or we can be really thoughtful about the work we're doing and, how we do it. And I think that's a leader's role all the time, but especially in a time like this when we really do need to adjust, we really do need to get really thoughtful. Um, Lean on the team to ask them about the work they're doing. Is there anything they see that doesn't have value? I think that's a big step that people can take, especially as we're looking ahead to next year. I know most of us are probably working on our annual plans and things right now. Like, right now is the time to look at the work, look at the partners, and say, is there anything we could take a step back from doing? And if so, like, do it, because I think it's going to help you really get lean and get focused on what matters for next year.
Yeah, love that. And maybe double clicking on that, when resources get tight, obviously, you talked a little bit about having conversations with your team and getting some of the stories of what people are working on kind of day to day. But how do you decide what to scale back and how and kind of what is non-negotiable?
Well, I think there's always some things that, if you're a good marketer communicator, there's always some stuff you're kind of experimenting with. There's some stuff really works. This X amount of percent of what we're doing, we know, like, this is the core stuff. We know we know it delivers value in what we're trying to do. It's either bringing us business, it's helping us manage our reputation, it's effective. We can measure it. Okay, that's your core stuff. I don't think you want to dig into that too much unless things get really difficult. So what about the other stuff? What about the stuff that we're not so sure? Like, we're not sure of the value. We don't have a good way to measure it. Again, I said a good marketer communicator they're always experimenting a little bit. So always doing some tactical stuff, or working with some partners, or maybe working with some vendors. Again, like, if you feel really confident that that's delivering against business goals and you can measure it, great. But if there's anything that falls into those categories where you're like, well, it's a nice to have, I think right now you sort of cut the nice to haves and really focus on that core work. So again, I think it goes back to just assessing, and you should be doing this all the time. I mean, I think anyone listening to this right now should probably have that list in their head right away. I know exactly what's working. I know exactly where I'm investing that makes sense. And I know a couple of things that I can live without pretty easily if I've got to decide to change course. And as some people might say too, like, and I know Suzanne does this all the time, what about being proactive? What about, like, taking that forward and saying, we're going to cut this so we can meet a target that we know is probably coming, or at least being prepared to say, if you get that tap on the shoulder, be like, we need to reduce. You've got the list. You're like, here's what I'm going to put forward right now. So you don't get in a sense of having to defend stuff sort of unprepared. You should never be unprepared for thinking about what you would get rid of if you had to do it on a moment's notice.
Yeah. Suzanne, how do you think about what and how to scale back?
Yeah, agree with everything Alan said. And, we each have at least 25 years of healthcare marketing experience. And I would say pretty much every 3 years, there's some kind of budget reduction that's asked for. And to Alan's point, um, I tell my folks they're saving money every single day. They're doing things smarter. Um, but what we need to remember is keep an accounting. I remember we'd have a big piece of paper on the back of the director's door, and every day that somebody found a savings, or they didn't print a publication, or they didn't do an event anymore, or we ended a contract, or a subscription came down, we would put a cost accounting on the back of that door so that when someone came a knocking to ask for the rent, we had the money. And there's always going to be an ask, and you always need to be prepared. And we still do that today. And my team is very creative about saving those dollars. I would say the first thing is most nonprofit organizations You can save a whole lot of money bringing your creative in-house. And we have a lot of agency partners who are fantastic, but we've saved 25% on booking all of our media. We're in a small media market ourselves, and we take the in-house agency, not-for-profit rate, and we save a lot of money that we're able to put right back into advertising. Sports sponsorships. Again, people who know me know that no one cries when you have to cut a sports sponsorship, unless someone who loves the football box or the hockey box or something. But again, as you go through and clean up your budget, there are probably some of those pain in the neck projects that you'd love to get rid of, or your team would love to get rid of. So make sure you put all of those up on the list. And again, take advantage of the opportunity to take those off your project list, and off of the staff.
Yeah, exactly. I think a lot of healthcare CEOs are getting ready to have to pay for their own box seats for NFL in the coming years if the trends continue. So, all right, obviously, anytime you talk about budget cuts, the conversation can drift into a gloomy place. I do want this to focus also on some of the positives. So, double clicking on something that both of you mentioned there, which is the being able to measure and defend spend. I've heard a lot of examples of healthcare organizations that in times like these have shifted their ad spends away from traditional channels like billboards, bus ads, and kind of those brand campaigns or potentially sports sponsorships, to more to digital because it's easier to measure and prove ROI. Is that something that you have both experienced? And how do you think about those trade-offs? And Suzanne, I'll go back to you first for this one.
Thanks, Dave. I would say yes, absolutely. As an organization, we've invested much more in digital technology and self-scheduling for patient appointments. So we're able to reach out to our own patients, find out what our own patients need, be able to drop tickets, whether it's for labs or imaging or specialty appointments, and make sure those appointments are made, kept, and billed, which is something that I always go back to, which is if you can look at all of the activities that you're doing as a team and say, how many appointments were made, kept, and billed. And if you can get that string right through and make sure that those patient appointments are generating new income for your health system, as well as being able to get more patients seen, that's always a value.
Yeah. Alan, how do you think about the trade-offs from more traditional
Yeah.
digital?
Yeah. Well, and especially for me, I think, I've had roles in the past where I did both marketing and communication. Today I'm focused on communication solely, but in the past in those marketing roles, obviously, you have to go where I think things are delivering the best ROI. And that means really just getting very, I think, strategic about the spend. On the communication side, the things that I feel like we really lean into right now, and I mean, going after as much earned media as we possibly can. The media landscape has changed a lot. So working to get coverage is harder than ever, but it pays off. I mean, it's still funny how much interest you can get from traditional media. If you have a big story placed somewhere, it still does really well. It still generates a lot of interest. So kind of maximizing that is something that, again, the only cost for that is staff time, right? So making sure that your pitches and everything are really effective, that you have the right kind of stories to get out there, not wasting the time of reporters, things like that. It's really important. And I also think that an opportunity for organizations is to lean into all their owned media. Like there's so much you can be doing with social media. And I know probably most people are, but that's just an area where you should go full tilt into that. Again, the only cost for most of it, unless you get into, you can boost and all that. I know there's some cost there, but really you can maximize your staff time and getting those stories out, getting positive feedback out, even things like our own blogs, things like that. Sometimes I've been surprised. We can post something on social media from like our CEO, and all of a sudden we'll get media inquiries about it. So again, we're like using our own channels to drive exposure, to potentially drive news coverage, things like that. And the cost is essentially nothing other than staff time and time thinking about the strategy behind it. So I think, looking ahead again to a time of more constrained resources, it's like every owned channel you have, blogs, social, whatever, if you're doing your own YouTube, any of that stuff, like max that out because that's something you can do for almost no cost. And also, again, thinking as much as you can do on a sort of proactive earned media PR side, very effective and can be done, I think, to Suzanne's point, to lining that up to your business objectives. And that's a really great strategy.
Yeah, I like that, and that also goes back to something that we talked about in the prep call, which is like for both of you, I think the way you look at things is if you need to make cuts, you would rather cut ad spend than people on your team. So like figuring out those ways, like Alan, like you just talked about, to leverage the people that are on your team and some of those owned channels to really get into win the hearts and minds of the people in your market is critical. I do want to ask one more question around, like, I think proving and communicating the ROI is becoming more critical than ever to show the value of your work. So maybe Suzanne, if you want to start and just talk about how you demonstrate ROI in terms that the leadership within your organization understands.
Absolutely. Well, I think it's always important for us to lean back into our mission, vision, and values as an organization. And in our organization, we're currently working on a strategic plan, as most of you probably are. But my team has really reached into what are the metrics in the strategic plan that are looked at by our board and senior leadership that we can help achieve. So those include unique new patients by medical record number. So that is the specific metric that we're measuring, our new medical record numbers. So once they heard that, they started gearing their marketing and comms plans to how can we generate more unique patients for the health system. So whether that's outreach, whether that's tests, vaccines, there's a number of ways to be able to do that. But being able to translate those metrics from the strategic plan right down to my team was really key. Other things are filled appointment slots. So we've already spent time and money to have providers available. So we want to make sure that we are using every filled appointment slot. And if Dave cancels his appointment in 15 minutes, wouldn't it be great if Alan could pick that up in 20 minutes and we have a filled appointment slot for later this afternoon so that we don't have anybody twiddling their thumbs because a patient didn't show. So we're doing more around that work. And certainly surgical volume, there's a lot that we do at our health systems and as not-for-profit, a lot that doesn't contribute to the bottom line, but certainly helps for community benefit. But surgical volumes are something that we know is really important. So filling all of those surgical slots and making sure that if Dave is on vacation, that Alan is a surgeon who is wanting to get in, is prepped and ready to take up that surgical time is really key. So our department also helps with initiatives like that and working with physician liaisons and outreach to make sure that every single slot is full.
Yeah. Alan, anything to add on demonstrating ROI to leadership?
Yeah, well, first of all, I would just say that one thing I've always really firmly believed is you never want to be in a position where someone's like, what does that team do? What does Alan's team do? What does Suzanne's? Well, I don't know what the value is. You don't want to be in that position because you want to get ahead of that. You want to be proactive. You want people to understand your goals, how you're contributing to the business, and what you're measuring. That you have to do that. So I think that would be one of my biggest takeaways for people listening today. If you're not doing that, if you're not being proactive about like explaining what you do, why you do it, how you measure it, that's key. I think we've shifted. I think, on the communications PR side, we've really shifted to try to get firmer on our metrics. So, in the old days, even of like a couple years ago, it was all about like impressions. Like, here's all the impressions we got. Okay, well, impressions are great, but what if it's negative news? What if we're in the news for something that's not so great? Okay, is millions of impressions about a bad story a good thing? No, it's a horrible thing. I'd rather not have those impressions. So we've really shifted to measuring what we call like power of voice, which takes into effect sentiment too. Like, what is the sentiment of this coverage? Is it positive news? That's more valuable. So we're trying to get that. So we're really trying to measure things like that. We also again measure, brand reputation, recall of messaging, all those kind of traditional measures as well. And then, my team focuses a lot on internal communications for all of our employees and really measuring like what's their engagement with the content we're sending. So we try to be very proactive about, again, going back to that. Here's what we do, why we do it, how we measure it, and then having very, strategic conversations with partners to make sure they understand all that and allow them to ask questions. Because again, I just never want to have someone come up and go, I don't understand what you do. Like, that's a failure on my part to have gotten to that person and explain it.
Yeah. Along those same lines, and Ellen, I'll direct this back to you first, but I think you talked about the old school, new school. So I think a lot of communication teams in kind of the old school view were seen as a cost center for the organization as opposed to a growth engine. What advice would you have to give teams that are still in that paradigm in their system, how they can help shift that thought internally?
Yeah, well, again, I think I would go back to what I was just talking about. So having those conversations with people who might have that opinion, and I do think on the communication side, it's a little more challenging than marketing because sometimes marketing is working on very specific initiatives that they can say, we launched a campaign and it actually brought in, X amount of patients. That's a little bit more clear cut sometimes. So on the communication side, what I would say is it's just people understanding the value of our reputation management efforts, why it's important to make sure that people have a good sense of the organization, who we are, and that it impacts a lot of things. It's patient acquisition, it's retention, it's employee engagement, it's recruiting, it's all those things. So I think tying in those really important business metrics that people are concerned about and making sure they understand how our work supports that. So again, I think communication is a little more challenging to say strict dollar for dollar. But again, what's the impact of having a bad reputation, a bad brand? And we also, I think there's a really good connection between the work we do in communications and supporting some of those marketing efforts that are going on in the community too, which are really more direct business related. But again, I would go back to the fact of have the right conversation with your stakeholders, make sure they understand the value you're bringing. And if there's questions about the spend versus the impact of reputation management or media, whatever, you have a chance to address it if you have the conversation. But if you wait till people are already asking, it's almost too late. You're going to get in a position where you have to really defend something from a defensive posture rather than being proactive about it.
Yeah. Suzanne, anything to add?
Agree with everything Alan said. And in terms of remembering our value as marketers and communicators, is that we are in our organizations, there's a lot of people, but we are so connected to being the voice of the customer. So if you understand what your patients are wanting and needing, and you're looking at that data about what they're calling about, what they want from you, what they're not receiving today, and you can bring forward to leadership ideas for growth, and what people really want and need and what they don't need anymore. Um, that's really key to being seen as being on the growth side. We're all shared services. We're all what they call overhead. We're not direct patient caregivers, but we have a special gift in marketing and communications, which is to be that voice of the customer. So I would say every time you're at a board meeting, every time you're in a meeting where people are wondering what consumers want and need, to go back to the data and be able to share that data, whether it's patient satisfaction or other consumer data that you have about what people want and need, and you will always be a valued person at that table.
Yeah, love that. I want to jump into one of the other themes of our conversations that we had leading up to this were on cross-functional collaboration, which I think can be a real accelerator, reducing friction and improving some creative problem solving and really increasing efficiency for the organization. But we all know that silos and competing priorities can get in the way. So, what are some common cross-functional tensions you see, and how have you handled them as leaders? And Suzanne, I'll go to you first.
Great question, Dave. And I would say, whenever there are passionate people doing really good work and important work, you're going to have natural conflict. That's not a bad thing. It just means people are very passionate about the work they do. But I feel like as leaders, our job is to be the buffer for our teams. And if there's an issue with HR or IT or finance or managed care or the med group or, you know, the CEO, all of those groups that we need to work with every day to get our jobs done, that it is it's our job as the leaders to have those uncomfortable conversations with our peers and to be the buffer, so that if there's issues that come up at the manager level or director level or VP level, that those things are being escalated to us directly. I would also say our teams found a great resource in only taking direction from vice presidents or above once resources get tight. There's a lot of people who would love marketing and communications resources in our organization, but unless it's prioritized all the way up to the VP level, and the VP needs to ask our director or myself for those resources, that we can stop a lot of the downward chatter by making sure that those gatekeeping mechanisms are really tight when resources are tight.
Yeah. Alan,
Yeah.
how have you handled cross-functional collaboration?
Yeah, well, the kind of example I was going to dig into a little bit is, there's definitely some inherent tension between marketers and communicators and people in PR. And I kind of always thought it's sort of like police officers and firefighters. They're partners. They need each other in certain situations, but they each are a little suspicious of the other. Oh, I think that group, they don't work quite as hard as we do. Like, what are they doing over here? And so I think you have to break down that silo a little bit and really say like, hey, we actually are supporting each other. And if the marketing team's going to put a big ad campaign out in the market, it'd be good to let the communicators and PR people know so we can, share it with stakeholders, let employees know, be prepared to back it up with some, media efforts, things like that. And vice versa. If we're working on a really, thorny issue that we are, concerned about, well, it might be good to let the marketers know, hey, you might want to hold back on launching that for a little bit. We have an issue coming up. So again, like thinking about how we work together is really important, and just building trust. I think it all comes back to explaining things too. I mean, the more the groups can get together to talk about, this is the work we do, this is why we do it, here's how we measure it, you'll really break down that kind of a little bit of like, I don't really think those marketers work that hard. They're not working as hard as the people on, doing with the news media, whatever. Hey, the reality is we both work hard in different ways. And if we can have the right conversations about what those are, that's for the best. And really talk about how we can support each other to accomplish what the business needs to have done, or to, manage the health of our community. Those things are really important. So I just come back to the fact that we got to be good at communicating. I think sometimes communicators were not good about telling our own story. Like, this is what we do. This is why we do it. Go back to that foundational piece, and you'll really be able to break down those silos a lot better.
I love that. Suzanne, I want to pick up on something you said earlier, which was you talked about some of the skills that you built. I think it was during the COVID time that your team is still using, where yes, obviously you wanting to get, patients acquired and into the building, but one of the other things that your team supports is physician and surgeon recruitment. And so can you talk a little bit about how you as a leader have had discussions with other leaders within the organization to kind of prioritize what are the things that they would like support on, um, so to make sure that you're aligned in delivering what they need most.
Absolutely, and a great question. And I think Alan and I would both say that um, this is the time to bring other people into your tent. So, um, in terms of a lot of the priorities that we have as a marketing communications team, those are not driven by us. They're driven by our employed medical group or HR or finance or managed care, that we are working on behalf of our clients. And a lot of times we've been enablers, so we feel like we have to get in there and justify why we're doing this work. I found having great colleagues on both IT and the medical group side be able to advocate for our team and our priorities. And if they want to reshuffle our priorities, fantastic. If they want to use their budget power in IT to go and advocate for a new system that will allow us to do our outreach to patients better, by all means, please fight that fight because, IT has a much larger budget than I will ever have. So, being able to have those aligned, united conversations as a team and with the CEO, because I've been in situations where I cannot show the ROI for some technology that I want to invest in, but I know consumers need convenient ways to self-schedule patient appointments. And at a certain level, you just kind of throw up your hands and think, does anybody get it? And if your CEO gets it, you're in a great position to be able to have them advocate for you. So sometimes they say you have to, give up the fight and let other people take up the sword for you. So I think that's really important during times of resource constraints.
Yeah, love that. All right, well, we're 43 minutes in on a topic around doing more with less, and we've successfully avoided talking about AI thus far, but no conversation about efficiency in 2025 is going to be complete without it. So Alan, I'll throw it over to you first, but AI is often touted as a way to improve efficiency. How are you using AI today in your teams?
Yeah, well, for specifically on the communication team, we've really empowered our team to think about like what are the right uses for this. So, we are fortunate to have a pretty big communication team. We've put together like a working group, like what are the AI tools we have access to, and we do have an internal version of ChatGPT. Many of our team members have Copilot on their Microsoft application. So we've kind of pulled together a small group, a work group, to really think about like what are the applications. I would say that most of the applications we found specifically in the communications realm, no surprise, they're writing, they're editing. I think especially on the editing side, I feel like there's such good value in using those tools to kind of like edit down long copy, create key messages, create social media posts. I still think there's a lot of concern about using AI directly for, just to start copies from scratch, because again, there's some accuracy issues, bias, things like that. But really using it as editing tool, really using that thought partner, thought starters. We'll use it for things like preparing questions, like what questions is this reporter likely to ask? And it'll spit out, 6 options. And we'll be like, okay, this is pretty good. And thinking of things like that. Also a lot of, internal communication, applications for things that are like, I think low stakes content write an article about, X health awareness a month, something like that. That's an opportunity. But again, I think that's like productivity options. And then, it is exciting. I think, I have some concerns about AI in various applications, but one thing that I think is really exciting is all the productivity tools it can do for a health system. And I'm not the expert on these things, but I know we're using them to, ambient listening for patient visits, to do note taking. Like that's taking a huge burden off our providers. Scheduling, managing that schedule for primary care doctors was so complicated. Those AI tools that are really helping, some AI tools around helping making referrals. And I think, we're going to get down the road too, where AI can really help with, patients manage conditions and things like that. So I feel very like bullish about AI in healthcare, where some other aspects of society I'm a little more concerned. But I think there's a lot of good applicability for like us as professionals and as our, health systems as a whole.
Yeah, Suzanne.
Same. And, such a gift, right? So it's a gift and it's a responsibility. I think it's a wonderful gift at shortening some of these time-consuming tasks or finding exactly the right phrase or the right word. And Alan has mentioned it as AI is like an intern. Like they're very creative, super enthusiastic, but don't let them loose without making sure you've got appropriate human oversight. So I don't ever want to put something forward from my team that looks like it was AI driven. I want to make sure that it looks like the tone is appropriate, that the information is inclusive, and that no one would ever automatically look at that news release and think, well, that was just spit out by AI. That's our job, to make sure that we're using all the appropriate human interventions and our skills and our gifts and our talents to be able to clarify that. The other thing that I've learned is that, and here at Renown, we have one member of our team who is very far forward in this. She's working with our head of data analytics to be able to have an enterprise-wide approach about what are people asking in AI. What is the data source that is underneath that, and how are we looking at the analytics? How are we ensuring our brand tone and appropriate oversight? What kind of governance do we have across the organization? So it's still new and exciting, but I love Alan's thinking of it as an intern. So that's really helpful for me.
And as you said, you're being insulted when someone says that looks like it was written by AI. And there's no deeper insult when it's actually not written by AI and you did it and someone's like, oh, it looks like it's from AI. And like, oh my gosh, like arrow through the heart.
Yeah, exactly. Well, we're going to transition to some audience questions here. So as we do that, and I will reshare my screen here, we're going to open up a quick poll. So Farah, if you want to hit go on that poll, and while that's open, and the poll is just if you'd like to connect with someone from Freshpaint afterwards, we'd be happy to talk through your current setup and how we can help your marketing teams really maximize the value of their budget and effectively use a full funnel marketing approach. So would love to talk to anyone that would like to have those conversations. So Kat, a couple of questions from the audience, and if anyone has questions, you can drop them in the Q&A and we'll go through those. But we talked about the interaction with leadership a little bit, but the question came in: how important is it in your view to have marketers at the C-suite table to help shape strategy and drive efficiencies when organizations are being asked to hold or cut costs? And Alan, I can
Yeah.
send it over to you first.
I mean, this might seem really simplistic. The closer you are to where leadership, where decisions are being made, the better, right? So, I mean, the more removed you are, the less influence you're going to have. So I would say generally, if you can make that work, absolutely. Some organizations more challenging than the others, but I think the more direct line marketing communicator leader has to CEO, the better, because again, you're going to be there with the conversations. I think there's sometimes people are in a situation where that's not possible. And what I would tell people to do is just look for the opportunities to get there. If there are opportunities to provide updates on what you're doing, touch points. So again, you might not be able to have a reporting relationship depending on your organization, but can you increase your touch points? But in general, I mean, the closer you are to where decisions are being made, the better you're going to do in the long run.
Amazing. Suzanne, anything to add?
Agree with everything Alan said, and just say that, we live in a hybrid remote world right now. But it's really important to be there. So a lot of us don't report to the C-suite, but you can certainly be on site. If your C-suite is on site and working in a office building every day, make sure you're there 2 or 3 times a week, and you know when the CEO and the C-suite folks you need to interact with are meeting, so that you can meet them in the hallway, meet them before they start their boardroom conversations. And as Alan also brought up, it's great to be able to, on a Monday, send out kind of what you're working on this week, and on a Friday afternoon, send out all the results we've accomplished this week and what's on our to-do list for the coming week. And if folks have other priorities or other initiatives you're not aware of, please do let you know immediately so that you can be responsive.
Yeah, I love that. Earlier in my career, I worked on a on-site job, as most of us had at that point. But was moved from one building to another where my office looked directly at the office of our CMO. And so anytime there was a question or something, and I would walk with her over to the cafe as she went and got a cup of coffee and say, "Hey, I want to run this by you," or "Hey, is this something that we would think about doing?" Those were valuable kind of not official conversations.
So important. Sometimes those are the best ones.
Yeah. We have a few more questions, but I do want to just as this is up, give a quick plug for an upcoming event that the Fresh Paint team is hosting. We do these house call events. This is the third one we've done this year. This will be in Chicago, September 16th to 18th, and we bring together marketing executives from across the healthcare landscape. And have speakers spanning, kind of the legal and regulatory implications, as well as best practices for healthcare marketers. It's a really unique event where everything is on us, so it's by invite only. So if you'd like to request an invite, you can drop a note in the chat, and we'll follow up there. But would love to see if you're available there. And as I promised, I'll have the audience's call to action here up as we go through the rest of our questions. So one of the other things that was brought up is adoption of technology. And I feel like there are a million tools out there right now that claim to add efficiency and save money. I work for one of them. How do you think about and evaluate potential new technology purchases or use cases when you're in a position where you need to cut budget? And I don't know if either of you feel, Alan, I saw you come off mute, so I'll go to you first.
Yeah, I could start. It's kind of a general question, but I mean, I think you have to weigh it against like what the need is, what the business need for the tool is, what kind of ROI you're going to measure it. Can you measure it? And I think too, like just being very intentional about understanding how you're going to activate this tool right away. I think one thing I've seen, and not in my current role, but in a couple of roles previous, is I went into an organization that had a number of tools that they just weren't using. They had invested in these tools, but they were not using them. So I think it's just key to, like, if you're going to invest in something, ensure that you have the resources. I've seen organizations sign a contract, and then not have a kickoff meeting for 6 months because they don't have the time for it. Oh, we've got this great partner, we've got this great tool. I don't have anyone to work on this project for a couple months. Okay, that's a huge miss. So I think it's may sound very fundamental, but I believe strongly, like, understand why you want this, and are you going to make a commitment to putting resources toward it? Because if you can't, you're never going to get the value out of it.
Agree. And, most of us have large technology stacks now. So unless it's on our roadmap for what we need next, and we have the foundation and the infrastructure and the internal IT security to be able to make it work, and the IT resources devoted to, as Alan mentioned, getting it off the ground, um, it will be a hard sell because, again, a lot of us have not invested a lot in technology and infrastructure. So some of the foundational work has to come first, to enable our systems to be able to run faster, better. But once we have that foundation, and that's really where we are now, we're looking to eliminate the number of applications we've got. So if we're able to um, eliminate 4 applications and have one enterprise-wide solution that works for a number of departments and a number of use cases, that's always very attractive for us.
Yeah, love that. Had a question come in on keeping your teams engaged and sort of the internal engagement. So any tips that you have on how you're helping your teams address pain points, or sparking their curiosity to keep them engaged on new things, or how you celebrate a big win within your team just to keep morale high? I don't know if either of you have particular thoughts on that.
I can start. I like the last part you talked about, because I do think too many leaders forget to celebrate like what's going well. And you spend so much time on like things that are difficult, or partners that are difficult, or whatever, or really kind of getting in the muck and not actually saying like, wow, here's a big win we have. So I feel like that's huge. And I think that teams can become disconnected and um, you know, can be really in a bad place if you don't celebrate wins more often. So that's a great one. And I think it's just a good reminder for all of us. Like, tell the team when they do a good job, tell each person when they do a good job. And it sounds so fundamental, but there's leaders, and I've worked for some in the past, not now, I want to be clear, but who never celebrated the wins, who were like, we did a great thing, we're just on to the next thing, let's go. Taking some time to celebrate, I feel like it's fundamental, but it's really valuable.
Yeah.
Agree, and feel like these are opportunities to bring people together. I know, it seems like it's award and conference season that we're right in right now. And I find tremendous value in being able to have our teams submit for awards, and sometimes win these amazing awards, sometimes not. Sometimes we're judges for other competitions that other people are entered in, and we see some whiz bang cool, amazing work that you all are doing, and we're able to celebrate your work with our teams. Or we see things all the time from out of industry, and we drag it back at a staff meeting and go, look at what they're doing here. This is so cool. How could we integrate something like this at Renown Health? And that's why we're all in this business, is we love making things better, simpler, and easier for people to access the healthcare that they need. So I think you're all doing great work, and sometimes that work is cost saving and resource saving. So keep your eyes open at all of the conferences that are coming up. Do participate in the awards, because recognition means a lot. And those certificates that people are awarded mean a lot. Just webinars like this today, and thank you, Greystone and Fresh Paint, for making this free of charge. Just keep yourself out there on a national level, a local and regional level. because this is a time for us to come together and help each other.
Yeah, love that. And I think that's a great note for us to end on. So Suzanne and Alan, thank you so much for your time. Thank you, Greystone, for hosting us, and everyone for attending and your questions. There are a couple of questions we didn't get to. We'll follow up directly afterwards with you all, but I hope everyone have a fantastic rest of your Thursday and a great Labor Day weekend. Thank you so much.
Thank you, Dave.
Thank you.